All right, welcome back to Wellbeing Wednesday. I'm Shawna Foose, one of your hosts from the Tulane Counseling Center, and I'm joined as always by my co-host,
Dr. Jinaki Flint. I'm staff psychologist here at the Counseling Center, and we are joined by 3 guests today. So you guys, thank you for coming, and please introduce yourselves.
Thank you so much for having us today. We're so excited about this chat that we're going to have. My name is Carli Gertler, and I am the dietitian at Campus Health.
I'm so happy to be back on Wellbeing Wednesdays. Happy to share the screen with so many lovely people. I'm Ryan Judd. I'm a social worker and a staff therapist at the Counseling Center.
I'm Jessica Chavez. I'm a psychologist at the Counseling Center.
Wonderful. So happy to have you guys. And our topic today is an introduction to health at any size. So we're going to pass the screen sharing over to Jessica and let y'all get started.
All right, so today we are going to introduce you to a concept that some of you may have heard of, and this may be a new concept to some. And this is called health at every size. Health at every size is a social, political health movement that shuns the idea that fixating on weight loss or that becoming thin will make us healthier or happier. So we recognize that health outcomes are not solely the responsibility of the individual and are actually really primarily driven by these social, economic, and environmental factors, which is requiring a social and political response. This movement, Health at Every Size, supports people of all sizes in adopting healthy behaviors. So it's an inclusive movement, it's a peaceful movement, and it recognizes that our social characteristics like our size, our race, our national origin, sexuality, gender, disability status, and these other attributes are assets, and it acknowledges and challenges the structural and systemic forces that interrupt living well and well-being. We are going to go over this Health at Every Size manifesto. These are sort of the main tenets of what Health at Every Size aims to achieve. Health at Every Size acknowledges that well-being and healthy habits are more important than any number on the scale. You can go back to the last slide, Jeff. So participating in this movement is simple. The first tenet is accepting your size, and this can be one of the more challenging areas to focus on. We want to love and appreciate the body that you have, and self-acceptance empowers you to move on and make positive changes. We want to trust ourselves. We all have this internal system designed to keep us healthy and at a healthy weight. So can you support your body in naturally finding its appropriate weight by honoring its signals of hunger, fullness, and appetite? Another tenet is adopting a healthy lifestyle habits. So developing and nurturing connections with others and looking for purpose and meaning in your life. This includes fulfilling your social, emotional, and spiritual needs, and restores food to its rightful place as a source of nourishment and pleasure, which we often lose in our diet culture today. Another way to adopt healthy habits is to embrace movement, right? So less punitive exercise, which we'll be talking about, and finding the joy in moving your body, connecting with your body, and becoming more physically active in your everyday life. We talk about embracing these intuitive eating principles of stopping when you're full and eating when you're hungry and seeking out these pleasurable and satisfying foods. Lastly, we talk about embracing size diversity. So the reality is that humans come in a variety of different sizes and shapes, and that true beauty is found across the spectrum. We want to support others in being able to recognize and embrace their unique shape and really celebrate all that our bodies are capable of doing as they are. Now, you can go to the next slide, Jess. So it can be really difficult to let go of wanting to control our weight. We're often led to believe that weight is something that needs to be controlled and that this is within our power, right? This is what we're constantly told by society maybe our healthcare providers. The reality is that we're really wired to maintain a healthy weight. I want to introduce this theory of set point weight. This is the healthy weight that your body aims for, and its preferred temperature on your body's weight thermostat. So set point weight is the weight that's biologically really ideal for us. It's the weight that's maintained when you listen to and respond to your body's signals of hunger and fullness, and the weight that we maintain when you don't fixate on your weight or food habits, and the weight that we keep returning to between diets. Our body works really hard to be in alignment with that point, with the set point weight, without manipulation from dieting. One thing to note is that our hypothalamus is the center in our brain, and this helps the brain and body communicate and connect. It can signal other body tissues to release hormones and enzymes and other chemicals to push us back to homeostasis. So for example, if our hypothalamus senses body fat levels are dropping too far below the set point, you might feel something like being cold, which is a sign that your body is trying to conserve energy and send less blood to the periphery by reducing our metabolic rate. Our bodies really resist weight loss, and this can be so challenging for folks who have been on diets to lose weight. So failing a weight loss diet is absolutely not a sign of poor willpower or weakness or poor discipline. So biology over willpower here. Our body tends to do things like alter metabolic processes when underfed, and this can sort of result in a host of different ways that our body tends to give us the signal that it's not getting enough nourishment. Aside from weight focus, failing to produce thinner bodies or even healthier bodies, it can really cause damage. And this extends to food and body preoccupation, these repeated cycles of yo-yo weight, weight gain and weight loss, distraction from really our more worthy and personal goals, health goals and goals in life. It can reduce our self-esteem and can really have this potential for causing or contributing to eating disorders, general weight stigma, discrimination. We're going to talk a little bit more about that interesting stuff too. So the message here is we don't have to worry about our weight, right? We need to work on trusting our body, re-engaging with these really powerful mechanisms so that our bodies can take good care of us once again without us getting in the way. One way that the medical establishment measures weight status, these categories of whether we're quote unquote healthy or quote unquote overweight or quote unquote obese, etc. For our height is the BMI. So many of us have heard what our BMI is, or have heard of BMI in the news or different studies. The BMI has many flaws, but it's really commonly used to assess health status because it's a cheap and accessible tool. It was originally created by a Belgian mathematician in the early 1800s and created using the data of European white men. So an activist named Sabrina talks about the racist and classist roots of BMI and fat phobia in her book called Fearing the Black Body. On BMI, she notes that it's both racist and sexist to use mostly white men within a study population and then try and extrapolate out and create norms and expectations for women, people of color. They have not been studied, included in the initial clinical analysis, and so the actual health outcomes can't be determined from those findings. BMI has really inextricably been linked with a host of different disease. Most recently, COVID-19, right? We see this in the headlines a lot, how obesity is sort of a precursor or something that increases our prevalence of getting COVID-19. So this can be really harmful. The reality is that our genes and lifestyle contribute only a really small fraction of the differences we experience in health. When we talk about social determinants of health, we're referring to factors that go beyond genes and lifestyles that really influence people's health and largely play out out of our immediate control. So when we focus solely on individuals' weight or health habits, we overlook these structural and political issues that affect health and well-being. Blaming illness on behaviors really stops us from addressing the policies and the systems that shape our lives in very unequal and unhealthy ways. And Ryan's going to talk a little bit more about this now.
Thanks. Yeah. So this is such an important concept that we need to understand. So, if I were to ask you right now to think about your health, you would probably both begin and end this thought experiment by thinking kind of exclusively about your physical body, right? Kind of a snapshot of the way your physical body is in this particular space and time right now. But that's really because we've been conditioned to think that way by a very overly simplistic medical model of science that, as we've already seen and will continue to see in this presentation, has really been built on racist, sexist, and fat-phobic assumptions about health and medicine. When we think about identity, we often use the concept of intersectionality to help us understand our identities. But we can use the same concept, the same idea of intersectionality as a lens to kind of understand and view our own health. And it kind of gives us a fuller, more complete understanding of our health and well-being. And so I'm talking here about what Carli mentioned as and what we call the social determinants of health, right? So these are social factors such as economic status, social community context, access to education, access to healthcare, quality of education and quality of healthcare, the living environment in which you kind of navigate day to day, as well as the more traditional things we think about with intersectionality like race and gender and sexual orientation and ability status. All of these social factors, these social determinants, have a huge impact on our physical, mental, and emotional development. So not just our health right now, but also on our development throughout the life cycle. And so they're playing a huge role in contributing to the state of our health right now. So we know that because of these social determinants of health, people living in larger bodies, as well as people with other intersecting marginalized identities, are at risk for more health complications and more negative health outcomes, right? And I'm thinking there's lots of studies that have kind of borne this out. I'm thinking of kind of the most classic one and well-known one is the ACEs studies, the Adverse Childhood Experiences study, that found that people who that their health is really negatively affected by some of these social determinants, these social factors, right? And we'll talk more about that a little bit later. However, you might kind of be thinking right now, like, this sounds like pretty bleak news. You might be wondering, if these social factors kind of determine my health, what am I supposed to do to, take control of my health or improve my health if some of these things are out of my control? And that's a super good question. But the reality is actually more complicated, right? That there are things that we can do to affect our overall health and well-being, things related to these social factors, okay? So the idea is that we have to stop thinking in such a narrow kind of arbitrary term, like in such narrow arbitrary terms as weight, which is just a number on a scale, or body shape, as being accurate indicators of our health, right? So there are plenty of meaningful interventions that we can take right now, that we can take part in, like, for example, finding affirmative communities, finding affirmative healthcare providers who subscribe to these more holistic and positive, theoretical foundations like health at every size, right? We can take part in anti-racist, anti-fat-phobic activism, social movements that are going to improve the overall quality of our lives. We can care for the environment. All of these things, and some of the other things listed here, are really like amazing things that we can do right now that are not going to only help to heal our own health and improve our own health, but also the health of our communities and our brothers and sisters in similar situations. So apart from kind of the social determinants of health, we're also going to talk a little bit later about some more specific kind of movement-related interventions that you can take part in to help restore your health and well-being as well.
So on the macro level, the diet industry really preys on people's insecurities, on profits from people's dissatisfaction and from fat-phobic attitudes. And I want to take a moment to talk about these beliefs that are kind of the core of diet culture, and talk about the way they play out in the home and with family relationships. So on that micro level, our most important relationships, those with our caregivers, are sometimes steeped in these really unhelpful attitudes about food and about the body. So those attitudes include, for example, believing that thin equals healthy, believing that hunger cues are something that one should ignore as much as possible, seeing the body as something that's malleable, shapeable, and that's something that restriction can help control. Or learning that diet equals being in control or having good self-control. It's like a moral quality. Or, you know, you may have learned that to fear weight gain is something that would, you know, be a really terrible outcome from your family members. Or believing that one's weight should be stable over time and not naturally fluctuate as it does over time. So these ideas, you know, can be something that maybe are kind of a relic from your childhood, if you grew up in a household with a lot of these beliefs, but they could be reinforced throughout the lifespan. So, you know, in the strict rules for eating and the cycles of restriction and dissatisfaction, which sometimes even can lead to binging, they create the illusion of being in control, right? Like they're sold as, you know, this is a way to be in control. But in reality, however, diet culture and disordered eating even can really take control away from people's lives. So it's a really, I think, powerful step to start seeing it in that way, that, you know, these things that sort of promise control don't actually provide that kind of control. But doing that, though, can sometimes be really disruptive in a family. And you can find that you might get pushback if you start seeing things in this way and your family members don't. So, you know, I just wanted to give a plug here to acknowledge how hard that can be to take that step, and how you might find that there's a lot of pushback within your family, and that it's important to seek support in figuring out how to set boundaries with family members, how to educate your family members about this movement and this philosophy, and about, you know, the science, you know, the kind of bad science that family members might be believing in. And, you know, you can do that through therapy or different kinds of social supports, you know, groups that kind of coalesce around this idea of health at every size. And I also wanted to take a moment to talk about health. So another belief that's embedded in diet culture is the belief that there's this binary distinction, right, between like healthy foods and unhealthy foods. And this binary way of thinking often manifests in really restrictive diets that are passed off as healthy eating or clean eating. But in some cases, these diets can be really restrictive and limiting. And sometimes I want to acknowledge also that sometimes people turn to these diets because they're hoping to get relief from some kind of gastrointestinal problem or some other health problem that's maybe where the diagnosis and the treatment is sometimes unclear. So people are looking for answers and looking for a way to manage their health in terms of these diets. But I also want to note that for gastrointestinal problems that are ill-defined and hard to treat, sometimes those can be related to, research shows that these are often, they co-occur with trauma, with various mental health problems. And many mental health problems involve, you know, that feeling that you're unsafe. Despite the circumstances being relatively safe in the present, you might be feeling for whatever reason that you're not safe. And that leads to an overactivation in the autonomic nervous system, right? So the autonomic nervous system, overactivation there can really disrupt the gastrointestinal system and the digestive system. And it can create a lot of gastrointestinal problems. And it's also in control of your emotions. So there's a real strong link between your emotional states, your sense of safety, and the way your gut feels. So I just wanted to give a nod to that because, you know, I think these diets that are meant to kind of heal some of these things, you know, sometimes people, because of diet culture, jump to the idea they need to drastically change their diet, restrict in some way. But that's not always the first answer that one should turn to. I think seeking support for your emotional challenges and looking inward to figure out maybe what else might be contributing to your physical health can be helpful. You know, and I think also, you know, in some traditions of medicine, food is seen as medicine, and that's important. I don't want to discount that. For some people, using food as a way to heal is really important, and there's nothing wrong with that. But I think when a change in diet leads to excessive worry, to guilt, to restriction that feels very rigid, that's when this can become problematic. So again, jumping to the conclusion that you need to change the way you eat is not always the answer. And there are other behavioral interventions, social interventions that can help calm the autonomic nervous system so it's not overactivated, and that can improve gastrointestinal health and other areas of health as well.
Yeah, so let's talk a little bit about, so Jes talked about diet. Let's talk a little bit about movement and exercise. Right. So, rather than focusing on kind of traditional forms of diet and exercise that we've already seen can be pretty harmful, let's talk about, how we can create a new relationship to movement and exercise. So we'll call these non-weight focused healthy behaviors. Right. So often we think about exercise as just really simply a means to an end, a certain way to move our bodies over a period of time so that a number on a scale will change, or as a way to modify the shape of our bodies. Right. But what if we reimagined movement and exercise to be instead about things like leisure and pleasure and social connection? Right. What if it was about having a good time, having fun, enjoying ourselves, enjoying our bodies and the natural world around us? Right. We could think about movement as kind of games or as a way of connecting with nature. I'm thinking about things like walking and biking and hiking, right? We can also think about movement as a way to, as I mentioned earlier, reconnect with our bodies through mindful movement practices. I'm thinking about yoga and Tai Chi and Qigong, just stretching, dance, walking meditation. All of these things can really help us kind of get back into our bodies and kind of reconnect and re-embody our physical state, right? Oftentimes in the modern world, because of some of these things that we've been talking about, we become very alienated from our own bodies, and we become very disconnected from that connection that is so vital, right? And so we can kind of use movement as a way to not only have a good time, but also to reconnect with our bodies and become more comfortable and more loving towards them, right? There's another way we can think about exercise too, as a way to improve our overall functionality, right? So this could be things like taking the stairs more often, or choosing to move more in your everyday life by doing things like cleaning or preparing food or cooking, or maybe deciding to walk to meet up with friends or neighbors rather than driving, right? So movement can also be about kind of just improving overall functionality in your life. It can also be about performance, right? So kind of changing the goal and the purpose of movement away from things like losing weight or, changing your body to some of these more productive, more positive goals, right? So, you can think about movement or exercise as performance. For example, like maybe you play tennis or racquetball, and the idea is that you're having fun and you're getting better. You're developing skills and developing this functionality, having a good time, and also, doing something good for your body, right? So we need to kind of think more about movement as a way to enhance our health, to enhance our lives, enhance our connections to our bodies and our connection to other people and to the natural world around us.
Yeah, I just to piggyback off of Ryan, movement should be fun. We want it to be really enjoyable and to be rewarding. And studies are showing that when we are able to get that sort of pleasure out of movement and activities, that's the most important thing for lasting lifestyle changes and lasting positive habits, right? So when it's exercise that's geared towards weight loss, well, maybe we don't get the sort of results that we're looking for. Our bodies aren't morphed the way we hope they would, or our weight doesn't go down the way we hope we would. So we just toss that activity aside. But if we're focusing on moving for connection and fun and the enjoyable, rewarding aspects, then usually those behavior changes last a lifetime. And to touch on diet too, we know with diet that eating more plants and more high fiber foods, maybe less meat, is beneficial for the environment and our overall health and chronic disease prevention. But as Jessica was saying, that this diet mentality, using the language of duality as healthy and unhealthy, or good or bad, or fat and thin, is really sort of damaging. We need to really lean into a more holistic view as it comes to nutrition as well. When we move from dieting for weight loss to overall healthier and more pleasurable relationship to food, I'm a big proponent of this concept of intuitive eating. I recommend everyone buy the book, read the book. get the workbook that comes with it. It is life-changing. And with that, we focus on really gentle nutrition. We focus on things like enjoying what you eat, focusing on variety from meal to meal and day to day. This unconditional permission to eat all foods. Yes, all foods fit. This elimination of food rules, rigid food rules, only being able to eat within a certain period of time, or certain food groups, and focusing on food as pleasure. We're one of the only cultures that totally has thrown pleasure to the wayside when it comes to food, and that's such an important part of health. And then discovering the satisfaction factor with eating. Food should be satisfying, rewarding, pleasurable, all of those positive things. So we want to segue from this diet culture to really a more mindful, intuitive way of eating. And this is something I love to talk about. So if you ever want to meet one-on-one or in groups and have this conversation, I'd love to do that too. Jessica was going to introduce this body respect pledge that we wanted to leave you all off with.
Sorry. So do you want me to read the pledge?
Sure.
Okay. So this is the body respect pledge, and sorry, I lost my train of thought here for a second. But a lot of times when I'm working with people who are feeling really stuck in diet culture patterns, and really in that place where they've bought into the idea that it brings them control. But they're starting to kind of see that it's a contradiction, that it's not really helping them to restore control. Sometimes there's that feeling of being stuck. Like, well, what do I do about this? I'm kind of between a rock and a hard place. Like, I'm so afraid of weight gain. There's so much terror there that I'm afraid to give up these attitudes or behaviors, even though I know they're hurting me. So I think that having some kind of affirmation or a reminder of the reasons and the intentions behind these changes can be really helpful to hold on to kind of instill that hope day after day. So that's why I thought this body respect pledge that Carli showed me was really cool, because I thought, oh, this is so great to use with people who are in that place of really kind of looking for hope and looking for purpose. Actually, Carli, do you want to read it? You found
Sure.
Pledge,
so I did not write this. This comes from the book called Body Respect, which is a great resource. It's by Lindy West and Aphramor. And it states, today I will try and feed myself when I'm hungry and honor my body's signals of fullness. Today I will try to be more attentive to how my body feels and choose foods that make me feel good. Today I will try to look kindly at my body and treat it with love and respect. Today, I will try to practice more mindfulness. Today, I will try to challenge stereotype, size bias, and thin privilege. Today, I will show more compassion towards myself and towards others. So I think that concludes our discussion based on these slides. And I wanted to open up the conversation to our hosts as well for any questions or comments.
Well, thank you all so much for this really fresh and healthy perspective. I know growing up in the US as a woman, especially, diet culture and the messaging around body type has been so pervasive. And I really appreciate the pledge and the idea that today, right, that every day is a new day to begin this process and really hold this kindness and compassion and tune into your body. I can get on board with that for sure.
Yeah, this was a great education. I think our students will get a great deal from it. And, just to piggyback off of Shawna's very eloquently stated response, I agree with all of it. I'm the exact opposite. I grew up in a family who had pleasure around food in our bodies. And so I didn't grow up around women who constantly struggled with how I look and am I fat. And so, but that can also put you in a space where you can kind of lose track of like how you're engaging with food and intake as well, right? So both sides of that can have areas where you need to be mindful of. And so I do love that the piece that really spoke to me was the nervous system health and how that all ties into how we see food, how we find safety, and also connecting to body through movement, right? And so I think that this was a highly comprehensive presentation and discussion that I hope that many of our students will watch and get something from, or people in general, because it's really, really one of the most concise presentations that I've seen around eating and well-being in a very long time. So thank you guys for coming here today and sharing this vast wisdom with us.
For having us.
I had a question pretty early on in your presentation when you were talking about BMI, because I feel like in traditional Western medicine, BMI is still taught to doctors. It's still something they're taught to use and use as a marker. And I wondered if you had any advice for a person who goes to the doctor who's using BMI as a marker and in a really punitive way, how they could respond to that physician or manage those interactions.
Mm-hmm. Yeah, this is something when Jinaki, when you were mentioning sort of not growing up in that environment, and I get so saddened when people start out with this maybe more peaceful, healthy relationship to food in their bodies, but then in the medical establishments and when they see their physician, that is all put to a challenge, right? It's like, well, did you know that you're quote unquote obese and you need to lose weight or else you're going to get X, Y, and Z. And that's really, really, really harmful and stigmatizing. And it's producing some really poor health outcomes for those that it affects. And to some extent, it affects most of us. And so I think number one, to tell yourself that you can fire your healthcare provider, right? And find someone more affirming, like Ryan was saying, find a more affirming space, and find one that is more aligned with this movement of health at every size. And I actually have these cards that I give to some of my students to bring to their doctor's appointments about not getting weight, right? Like are so few reasons why a physician or a healthcare provider might really need our weight. If I'm going in for acne, I don't need to get on a scale. And so really sticking up for ourselves and saying, you know what, knowing my weight or being told about my weight is something that's harmful for me. And I don't think, the data and the studies suggest that this is not something that needs to be part of my healthcare. And so I don't want to get weighed today. Or if you do weigh me, please, can I, weigh without looking at it? Can it be a blind weight? Or can you please not write it down when you give me my chart to give to the receptionist? Can you please keep weight out of our conversation today and treat me the same way you might treat someone in a thinner body? So those have been some helpful ways to sort of navigate the weight-centric way that medicine is practiced today.
That's so helpful.
Yeah.
And I think,
Yes.
Go ahead, Ryan.
Oh, I was just going to say BMI, like insurance companies use that to like for your rate. I mean, it's unbelievable, right? And I mean, it's so arbitrary. I mean, like it doesn't take into account things like muscle mass. I mean, just for example, like you could be a muscular person and be obese too. I mean, just another example of how silly this is, right? I mean, it's just ridiculous that this is being used, to charge people for their insurance and also like to determine, to give you an assessment of your health when really it's very arbitrary.
Yeah.
And on top of that, I think, Carli, thank you, because you just spoke exactly what happened to me. I remember the very first time a doctor said, you're obese. And I was like, no, I'm not.
Sure.
But it speaks to how people, when we talk about issues around even health at every size, when people think of that, people always think in one direction. So it's all about gaining weight, right? But there are people who struggle with weight in control and safety who are constantly working out. They look the part. They are not obese at all, quote unquote, right? They do not look large, but they still struggle with issues of safety and eating and exercise, you know. And then I hear people all the time say, oh, I didn't work out today, I feel so bad. What? You know, and so that's really taking you out that you missed one day, like, you know. And so it's that socialization piece that I think that you guys spoke really well to, is how we're being socialized to think about this and that dichotomous thinking on it.
Yeah, as a parent of a young child, you know, it's like you spend enough time around a baby. I always say this, but you spend enough time around a baby, you know, who's taking a bottle or nursing, and see how kind of amazing that is, and the sense of safety that it brings the baby to be fed, and also just like the way it, you know, the family kind of revolves around feeding the baby.
Yeah.
And if you see where that ends up sometimes with this attitude of like counting calories, the very utilitarian ideas about food, not, you know, taking pleasure out of the equation and counting calories and calculating how many calories one ought to burn if they were to eat, you know, it just, it's such a departure from where, you know, it sort of starts. And it's, yeah, it's sad that the meaning of it and the relationship to safety and pleasure and comfort and connection gets so lost.
Yeah, and you know, we're all born, Jessica and I had this conversation yesterday, like we're all born intuitive eaters. Like we are born and we know where to get our nourishment from right away without having to be told or led. And really early on, that relationship is sometimes disrupted, right? That clean plate club thinking, or, you know, you have to eat your vegetables before getting up, or you have to finish your dinner before dessert, or, you know, you can only have one cookie, or whatever it might be, you know, really sort of challenges that intuitive relationship we have with our bodies and with food so early on. And then our society just sort of takes that into and amplifies it. And so I think that, you know, the big takeaway is that there is so much work to be done, and this is not on the shoulders of any individual. This is really systemic, right? And as a society, like, we have got to do better, because the rates of eating disorders and disordered eating and just punitive, unhealthy relationships with our food and exercise and our bodies, like, this has got to give. Something's got to give. It's just, it's not helpful for anybody. It's really not.
Yeah, it's pathologizing the individual without and ignoring the system that has created the environment in which these mechanisms start to take place. Because if you don't feel safe, you are going to engage in some defense mechanisms to survive. The body wants to keep you safe. And but the systemic piece, you are absolutely right, gets ignored.
Yeah. I think I'm sitting here thinking, like, we live in New Orleans, which I think is one place in our country where there is, you know, so much festivity around coming together in community, eating and moving, so much dancing and parading and marching, and all of that. And we've lost a lot of that right now because of the pandemic. And so, you know, I just think about our students, and that's such a big piece of coming to Tulane and being in New Orleans, is getting to be a part of a culture that is a little bit different, I think, than other parts of the country, many other parts of our country. And we're missing that right now. Yeah. So real quick, I want to talk about ways that we can support students who are listening to this and thinking, oh my gosh, that's me. I want to understand this better. So Carli, can you talk a little bit about what it would be like if a student would like to come and meet with you at the health center?
Absolutely. So I am open to seeing all students, undergraduate, graduate, and it's appointment-based, so you don't have to be referred by another provider. You can sign up via the patient portal or by calling the student health center and speaking with the patient representative. And so typically we meet for about an hour, and then we plan for some follow-ups after that. And there is unlimited amounts of sessions, and we don't bill through insurance, so there are no limitations in that scope. And I do work alongside our healthcare providers here and the counseling center folks as well. And other really helpful individuals across campus. So we try and really do comprehensive interdisciplinary care. And I also really recommend, if this has sort of piqued your interest, there's some amazing resources. The first I would say is the Health at Every Size book by Dr. Lindo Bacon. The book Body Respect is quite amazing. And I absolutely love, I've said this many times and I talk about it with students all the time, but the Intuitive Eating book and the Intuitive Eating workbook are incredible too.
Great. We'll get those book references from you and put them in the description of this episode so folks can access those directly if they're interested. Ryan or Jes, could you talk about the ways students could find support in this area at the Counseling Center?
Yeah, so at an initial consultation, if you feel comfortable in that setting, you can tell your consultant clinician that this is something that you're interested in working on. If you've been in therapy in the past and know that it's helpful to have a longer term relationship with your provider, they can help get you connected to the care coordinator to find someone that specializes in this area in the community, or they can help pair you with someone for short-term therapy at the counseling center who will be able to help you. There's also a group that it didn't run this semester, but should be starting in the spring on finding your body liberation. So if you're interested in group, we can help out with that as well.
Great.
Anything to add, Ryan?
Yeah, anything to add?
Yeah, I mean, just to re-emphasize what Carli said about how we work on this interdisciplinary team. We have an eating concerns team, and so if you are kind of struggling with some of these issues, we at the Counseling Center, we can kind of play a role in helping to get the treatment that you need.
That's great. I'm going to share my screen real quick just to put some of these resources on the screen. So if you're interested in seeking any support in this area or other areas related to your mental health through the Counseling Center, it's really simple to make that first appointment. So you just call us directly. You get to speak to Belinda or Charles Zetta that you see on the screen. Just call 504-314-2277. And they'll do their best to get you scheduled that very same day. So you get to speak with one of our clinicians, and you can kind of let them know what's going on and what kinds of things you're interested in working on in counseling. And then they'll make some recommendations and help you get connected. And our services right now are all conducted via Zoom so that everyone can stay safe, but we can be mask free so we can really see each other's faces and communicate as clearly as possible. As Carli said, if you're interested in meeting with her specifically to talk about nutrition, you can call the Uptown Student Health Center at 504-865-5255. Or you can make a nutrition appointment directly through the patient portal. So you can use that as well. Don't forget to follow Campus Health on all social media, particularly Instagram. You can view these episodes now on IGTV, or you can subscribe to the Campus Health YouTube channel. All these episodes are there. As always, I like to conclude our episodes with some humor, and being that this is Wellbeing Wednesday, but we're pretty far into this semester, I think we're all feeling like it's the middle of the week, it's the middle of the semester, we gotta hang in there. We will get there. The end of the semester is coming soon. So I just want to thank all three of you and Jinaki always for being here with me as my co-host. This topic I think is so valuable. I hope you'll come back. I feel like we just scratched the surface.
Yeah, I think we should have ongoing discussions about this in particular. I think students will get a lot from it. I'm actually thinking about putting the Body Respect Pledge as in our restoration station as a distinct meditation, because it is so important to start with today. Just start with today. Right. So thank you guys for sharing so much wisdom, but also for sharing these extra pieces that students can do right now.
Right.
So yeah.
All right. Well, thank you all so much. And we'll see everybody back here for next Wednesday's episode. Be well.
Thank you.